Hello, my name is Lila, and the heart disease I will be discussing today is mitral valve regurgitation. Mitral valve regurgitation disease is the most common of all the valve regurgitation diseases. So, you could have like aortic valve regurgitation, pulmonary, tricuspid. Um, so there are other ones, but mitral valve is the most common. In a healthy working heart, you have the four valves: the aortic valve, the mitral valve, the pulmonary valve, and the tricuspid valve. All four of them work together to keep your blood flow going one direction. So your blood should never be going backwards, it should always be going one way. So in a healthy heart, starting like at the right atrium, blood flow would go from the right atrium to the right ventricle to the pulmonary arteries, going into the lungs to grab oxygen, going from the lungs into the pulmonary veins, into the left atrium, and then into the left ventricle, and repeating this cycle after like going down into the muscles and the rest of your body coming back up. Repeating the cycle again. So that would be healthy blood flow. There would be no backflow in that. When you have mitral valve regurgitation, that means that the mitral valve is either like opening partway, like opening partway, or closing partway, but like leaving a gap somewhere. So either way, it's opening and closing, but not completely, which causes backflow of blood. In mild cases, some people don't even know they have it. They never know they have it. Some symptoms for mitral valve regurgitation would include things like shortness of breath when you're laying down or resting, when you're not like doing anything, fatigue, dizziness, swelling of the feet and ankles. You also have heart palpitations, um, and irregular heartbeat. Also, chest pain. Sometimes it can cause chest pain. The more severe symptoms would include heart failure. Also, heart enlargement is possible, specifically to the left atrium. That's more common for enlargement because the valve is in between the atrium and the ventricle, so that's where the issue would arise. There would be too much backflow going into the atrium instead of it draining correctly into the ventricle on the left side. We're talking about the left side. So, like I said, mild cases may never know that they even have it. Um, so for like mild case treatments, if it would just be like if they somehow found out they had it would be like regular checkups, just where they would run some tests on you to make sure it's not deteriorating anymore and that you're still doing okay. In a mild to severe case, they would do certain medications, and in severe cases, medications and surgery. Um, if you don't have surgery, like I said, severe symptoms, heart enlargement, and you could like die, heart failure, things like that. Some things that put you at a higher risk would be old age, any other heart disease, um, radiation to the chest area. Some tests that they can run to see if you have it is an echocardiogram and electrocardiogram. So even if you somehow have a mild case and find out you have it, they would just run those tests and do checkups and stuff like that. Um, I do think that is all. Thank you.